when lives are on the line.
Are there any obvious injuries?
These men and women will risk theirs
The lad who was driving got blood coming out of his face.
to save yours.
RTC truck.
They deal with the most serious injuries.
The patient is described as bleeding heavily.
Directly below his ear. There's a lot of blood there.
The most critical illnesses.
The reports of a male who's in cardiac arrest, and without any action, the patient will die.
The two Yorkshire Air Ambulances cover Britain's biggest county.
He's fallen 30 foot from the roof.
Oh yeah. He's got a big cut to his head.
5 million people rely on them
She's absolutely locked in. Okay, good.
to deliver cutting-edge emergency medicine
We're just going to go to sleep. He's not looking particularly good.
at high speed.
If you can activate your major hemorrhage protocol.
Every day brings high stakes.
He's been run over by his own lorry.
So it's gone over him properly, all the way.
It went right all at top of it. Wheels in touch with it.
So we think he's got a chest injury, possibly fractured pelvis and some lower limb fractures as well.
The matter? I can't breathe.
High risks.
We've just been tasked to a motorcycle RTC.
That traffic's been stopped there, look.
What happened?
You've come off your motorbike. Anybody not happy? Ready, brace, roll.
And high drama.
What is it? Cardiac arrest, mate.
Young cardiac arrest.
27.
Oh, Jesus. So that's the leisure centre directly ahead.
25 stone. Maybe this could be a nightmare airway, so we'll draw up drugs on the scene.
So this is emergency anaesthetic in the street. It is a bit risky, but it's what he needs.
Are there any chemicals or other hazards? Is there anything leaking or anything like that?
I don't know.
At Air Ambulance HQ, there are reports of a bizarre accident.
He's been run over by his own lorry.
Any obvious injuries?
She thinks he banged his head.
It's a case for Helimed 99.
Getting down from scene. Roger, Roger. I just think he's been run over by his own milk truck.
Let's go to V12 departure over there and we'll get going, shall we? Yeah.
Pilot Owen is flying his medics 30 miles to the scene of the accident.
Okay, I'm off with you now. That's clear, that's clear.
Dr. Brian is on the team with paramedics Pete Rhodes and Pete Valance. All they know is the information they overheard on the 999.
It's come in from a caller who's gone back to the house to phone the ambulance service, and it's just reported that someone's been run over by a truck.
They're racing towards the Pennine town of Keighley.
You see you've got the high ground beyond the town, You've got the area of moorland. Bradley's basically the other side of that moorland. Roger.
They're circling a line of terraced houses on a steep hillside.
Is it in the village itself, is it?
It's looking like...
down here now at 3 o'clock, I believe, where these caravans are.
Roger.
Just beyond that.
Oh, yeah, I've got the
yeah.
DC police car.
Yeah, okay, you
This
look at the
little
caravan.
farmstead.
The team must get up to speed quickly, with a briefing from ground paramedics.
We've got a 57-year-old gentleman called Peter, Milkman. Look, these little low-bedded van. He's gone up, slow down slow.
Peter Brame is lucky to be alive. He's been in the ambulance 10 minutes now.
Hi guys, how are we doing?
A bit tight for space.
Yeah.
He's been crushed by his truck. With a full load, it weighs more than 2 tons.
Did it run over you?
Yeah.
What did it go over?
It went right all at top of me. The wheels in touch with it.
Right. But did the wheels go over your body?
No.
But it's feared the underside of the vehicle crushed Peter's torso as it rolled downhill. He'd got out to deliver his bottles.
He was laid in front of his van, sort of pushing himself up off floor a little bit, and then, I got out. He wasn't really talking, so I've knocked on this house door over here, rung an ambulance, and then, that's it.
Brian wants to identify Peter's injuries. They're internal and hard to spot.
Can you give me a big cough? Big cough. What hurts?
Everything.
When you cough in your chest, does it hurt?
Yeah.
Whereabouts?
All over.
Okay.
Does he have any tenderness around the pelvis, or is it just the mechanism and that bruising?
So give us an arm a moment, Peter. Thank you, fella.
It's feared his pelvis is broken. They're going to fit a tight binder around it. Brian knows that understanding what happened is key to treating his patient.
It's come backwards?
Yeah, it come backwards. And the guy who was first on scene basically said that he wrenched the handbrake up one notch.
And was he still under it?
No, he was in front.
So it's gone over him properly, all the way, hasn't it?
I suspect it has maybe.
Yeah,
because otherwise he'd have been laid.
Otherwise he'd be dead?
Yeah.
Okay.
We think that this his milk float was up there in that slope and he was behind it. And something's happened now, the handbrakes failed, but the whole thing has gone over the top of him and he's been underneath, but been very lucky not to have been crushed by the wheels. But the clearance isn't that much, so we think he's got a chest injury, possibly fractured pelvis and some lower limb fractures as well. So what we're going to do is, he's on the back of this ambulance, we'll make sure he's comfortable and then fly him to the LGI.
Pelvic injuries can lead to lethal internal bleeding. Peter's life is in real danger.
So we're going to fly you through to hospital. That's because of the type of injury you've got. We want to take you to a trauma centre for assessment, and that's going to be Leeds. And you know what roads are like down to Leeds, yeah? So it's an easier option. You can get checked over fully there. Yep.
Peter's a well-known figure in the area. He is the 5th generation of his family to be a milkman. A customer has alerted his mum, who has come to the scene. She's naturally concerned.
Ferry, yeah, she's on her way. Yeah. Okay, love. Just do as you're told, won't you?
The same thing.
He's being carried to the helicopter for his flight. 12 minutes into the heart of Leeds.
Okay, you can pop down bottom end and just feed in.
Right, winch to the left we know about. That's the issue we've got to go there. Got those wires. Okay, 101, we've gone in after there, we've got performance. Alright, you put a grid in for LGI, that's lovely. Bloody jolly.
The team are looking for signs of bleeding, but the pain-killing drugs can affect blood pressure too.
His BP's back now. It was consistent, his BP dropping in relation to the morphine. Yeah. I gave it first 2.5 just to see if it'd have any effect. It went down to 111. That second bolus, it was down to 58.
We're able to tell a lot of things from looking at the monitor. One of them is his respiratory rate, which gives us an idea of how his respiratory function is, and we're looking to see if that goes up or down.
What's the matter?
I can't breathe.
He can't breathe.
Nice and steady with breathing if you can. It's nice and steady with that oxygen.
If he said he can't breathe, I'm nervous about the pneumothorax on the right hand side. But currently, his observations are all okay. So sometimes it's important not to do anything until we get down, so I won't do anything unless it's extremely necessary in the back of this helicopter.
Brian suspects Peter has a collapsed lung, a pneumothorax. If he's sat, the level of oxygen in his blood falls further. He may need to operate in mid-air.
97
sat. One thing we'll have to do will be put a needle into Peter's chest on the right-hand side to hopefully let some of the air out that's potentially collapsing his lung. So we're not going to do anything, and hopefully we'll be at the LGI shortly.
Thankfully, the flight is almost over.
NS from 99, we're on finals for LGI.
Okay, he's got the small white cranes coming down to wind, so you can speed back.
Owen is trying to navigate around the many cranes in central Leeds.
Yep, got the 3 yellow ones.
And safely land on the helipad of the LGI.
Right, getting towards the goal, he committed to LEP.
Peter's heading straight to resus.
How are you doing, Peter? We're in hospital now. All of a sudden there's going to be 1 million people prodding your body, okay?
The fight to stabilise their patient is stepping up a gear.
Peter, 56-year-old gentleman, about 12:30 was standing behind his milk float, which then reversed back down a hill over the top of him, and he was found with the milk float down here, and he was lying there.
Peter's very ill and is now in need of life-saving surgery. At Air Ambulance HQ, the team have just finished tea.
Go for a wee, I might have a job if you need a wee. I'm setting you off on it. Where are we going, Gav?
M18.
Pilot Steve and paramedics Gav and Sam are heading to a crash on a motorway near Doncaster with trauma consultant Neil.
We've just been tasked to a motorcycle RTC not far from our airbase in Nostell. The reports have come from a ambulance which has been passing, I believe, on the opposite carriageway and seen the accident and phoned it into our emergency operations centre as an urgent call.
It's happened on a 70-mile-an-hour road connecting the M1 and the M62 Trans-Pennine motorway.
The fact that the motorcyclist has been reported as unconscious suggests that he has a traumatic brain injury, so an injury to his head.
That traffic's been stopped there, look.
Oh yeah, they have. Yeah, they've stopped at the other end.
Right,
Yep.
guys, we're ready to come down this time round, I think.
Police have now closed the motorway, and it's clear for Steve to land.
You're just in front of the police car.
Yeah, that's good there.
The sign's gone.
I'm just going to come left a bit more, because if they reopen that carriageway, I don't want my blades over the... Happy there?
Yeah, tail's clear.
Thank you.
The biker crashed after hitting a huge lump of metal that came off a truck.
Nigel, I'm Neil, I'm one of the doctors. How are you getting on? Open your mouth nice and wide, stick your tongue out. Very good. What hurts? I know you've been asked this.
Shoulder, left shoulder.
Anything else?
Other and abrasions.
Okay. I'll just have a quick look at you again and then we'll come back and talk to you, Nigel, all right? So he's fractured his left clavicle.
Okay. How old is he?
How old are you, mate?
But many of their questions are going unanswered. Nigel is confused and showing signs of memory loss.
What happened?
You've come off your motorbike. I'm not quite sure of the circumstances at the moment. So his pubic symphysis is aligned, his spines are aligned.
Nigel's been riding down the motorway, and what we've been told is that a large piece of metal has come off a lorry that was travelling in front of him, and he's tried to avoid that piece of metal, which has caused him to come off his motorcycle. If you look at the actual object of metal, it's actually quite large, and if that hit the bike or hit him, it caused quite a lot of damage. So he's lucky really in that respect.
Their patient is a retired traffic cop. Caught out by a freak accident he had no chance of avoiding.
Just wiggle your fingers on this side, give my fingers a squeeze, and that side. Very good. You can feel that, huh?
Yeah.
Okay. Keep your head nice and still. We've got a blanket.
Nigel's rescuers did the right thing and left his helmet on to protect his neck. Now Dr. Neil is going to carefully remove it.
Right, we're just going to ease this helmet off, all right? So just support your head. Let's just see if we can get it off. Keep your head nice and still.
Apart from a broken collarbone, there's no sign of any open wounds. But the team's biggest worry is a head injury sustained through his helmet.
How are you doing, fella? All right? So we'll open your eyes.
It's looking like he has severe concussion, at best.
Right, Nigel, put this hand across your chest.
Where am I?
You are on the M18 near Doncaster.
They need to get him to specialist care.
Anybody not happy? Ready, brace, roll. Okay, and down again. Thank you very much.
Sam's alerting doctors at Sheffield Northern General.
Jesus 15, up to stable. His blood pressure is 150 systolic. Injuries, he's got some left-sided chest tenderness.
There we go. Okay, sir. All right.
Nigel's injuries are potentially very serious.
What's the last thing you remember?
I'm trying to think.
Okay.
I don't remember anything of the collision.
After 30 years of dealing with accidents, he's now seeing an emergency from a very different perspective.
Very signs at 4 o'clock, Steve. Thank you.
The air ambulance flies more than 300 crash victims every year, and the M18 has once again been brought to a standstill.
We've asked police and highways just before we've lifted to close both directions and the slip road, and then we've lifted safely from scene.
Doncaster radar, hello again, it's Element 99 Alpha. We're just lifted from, we're looking to transit the northwestern corner of the zone, VFR, routing direct to Northern General.
It's a 10-minute flight to Sheffield, but Nigel's condition is not improving.
Is any of your memory coming back? Have you remembered what happened?
No idea.
Okay. We'll talk to you again when we land at the hospital after we've done the handover. Okay.
Up front, pilot Steve's eagle eyes are at work.
I can see the helipad.
Is it around the nose?
It is.
Helimed 99 is touching down at the doors of A&E.
Textbook, Steve.
Nigel's heading for brain scans. It's feared he may have a serious head injury.
There we go, Nigel. We've arrived at the Northern General. So we'll slide you out on the stretcher. And then we'll just do a quick handover to the team.
Dr. Neil works at this hospital when he's not flying.
Slide, ready, set, slide.
He knows that Nigel is in safe hands. It's summer at the seaside, but on the prom in one resort, a life or death emergency is unfolding.
Let's lift. What is it?
Cardiac arrest, mate.
Alright.
Young cardiac arrest. 20-odd.
21?
28, 7,
Oh,
27.
Oh, Jesus, seems so.
Dr. Chris and paramedics Andy and Lee are racing to Bridlington. Seconds count, and the best landing site is out of the question.
Lifeguards have advised the beach is not suitable for landing. Tide is on its way in. There might be somewhere you can land further up, but I'll leave it to you to ready.
Yeah, Roger, take it from that this patient is outside and not inside a property.
Yeah, outside East Riding Leisure Centre, just off the promenade.
We've just been tasked to a cardiac arrest up at Bridlington, so right on the east coast. So that's where their heart stops, their breathing stops. If things don't get any worse than that, and without any action, the patient will die.
I've got a landing site suggested by Coast Guard and crew. It's off Lime Kiln Road, and it's a coach car park. Patient's 25 stone. They're now rocked with spontaneous breathing, ventilated through an eye gel. They've advised 12 leads shows an anterior septal infarct.
Ground paramedics have managed to restart the patient's heart, but his life is still on the line, and his size is against him.
25 stone, maybe this could be a nightmare airway, so we'll draw up drugs on the scene.
So that's the leisure centre directly ahead, just to the left of the big wheel.
Yeah, so that's he's arrested down there somewhere.
Yeah.
Bridlington is packed with summer visitors.
Now I'm just going to do one orbit around there.
All right.
So the ambulances are on the front there, see?
Yeah.
They're on the southern edge of the last ambulance
Well,
there.
it's like they're just rolling stretcher towards ambulance now.
They're putting him in now.
We'll meet him up there then, eh?
So let's go to where we said then.
Yeah.
Okay.
Yeah.
There's nowhere closer to land. Pilot Steve's heading for the coach park.
It looks like you've got Coast Guard and police officers in the coach park. And
Yeah. I've got one stanchion that's below us on the right.
Yeah.
Another one coming up into the 2 o'clock.
Yeah.
I'm going to keep coming forward. I'm going to come right a bit more now.
Yeah. You're good to the left, mate.
Thank you.
There's 98 landing next to Coast Guard station.
The patient's arriving at the same time as the team.
Hi, it's Chris. Hello, you alright? Hello.
Sir, this is a 27-year-old man, I believe was called down.
Yeah.
Basically, was witnessed to start having a seizure.
Yeah.
About 10 to 4.
Yeah.
Daniel Howe collapsed on a family day out, and pool lifeguards started CPR.
So there's a 10-minute downtime from them being on scene to us being. He had one shock with them.
Yeah.
And he had 2 rhythms that were non-shockable. He was in PEA for 1 cycle with us.
Yeah.
Had 1 round of adrenaline at 4:05, and we got a ROSC at 4:10.
Okay, and he's got some cardiac history, is that right?
So he's got, he's had a previous hole in the heart, but that's self-healed when he was younger. He's apparently got a faulty valve, but they're unsure which valve.
Yeah.
And apparently he had a narrowed aorta when he was younger, but apparently that was rectified. He takes no medication, and apparently he's not allergic to anything.
All right, so what we need to do, guys, is get him out, and then what we're going to do is put him off to sleep. Okay.
Daniel's heart could stop again at any moment. Anaesthetising him here gives him the best chance of survival. But there are no guarantees. He's still critically unwell. In a seaside coach park, paramedic Andy is setting up an operating theatre so Dr. Chris and the team can put a critically ill patient into an induced coma.
Right then, are we happy?
Yeah.
So on move, ready, steady, move. Let's get him set up so it's right underneath him.
Have we got any more stuff like that?
Coast Guards are protecting patient Daniel's privacy from passing tourists.
Right, now we're just lowering back slowly, see what it's like.
He owes his life to lifeguards and his auntie, who saw him go down.
We were just out for a family day out. We were just wandering up the promenade, and then we just heard a commotion, and he was on the floor having some sort of seizure. He sort of landed in the recovery position, and he was responding to us and saying he was fine, he was fine, he was fine.
So we're just going to lift the patient, okay? Ready, steady, lift. Thank you.
And then he just seemed to go into some just cardiac arrest, I guess, so we had to get him on his back, and he had stopped breathing.
I know it seems fussy, but getting his position is going to be crucial to sort his airway out.
And then eventually the ambulance came, so they had to give him compressions and just worked on him with CPR for quite a while, really. And yeah, now we are.
Okay. Right, guys, so what we're going to do now is just a quick checklist, and then we're going to get this guy off to sleep, okay? So this is an emergency anaesthetic in the street. It is a bit risky, but it's what he needs, okay? So, ready, good to go?
Dr. Chris and the team will first sedate Daniel, then take over his breathing.
So, Lee, he's probably at 150 kilos.
His size means he'll need bigger drug doses, and putting a tube down his windpipe could be very difficult.
So team brief is this guy is pretty big, so he's going to be a difficult airway. So plan A is going to be to intubate him. Plan B will be to go back to this eye gel and then do something different for the second attempt. Plan C will be front of neck access, which I can feel, but he is big. Okay, everyone happy with that? Should we get started?
Yes, checklist complete.
So silence unless it's a safety thing, please.
Yeah.
Okay.
Fentanyl's going in, Chris.
Okay, fentanyl's going in. So all but 1 mil, good. Yeah. And are you going to time a minute for us?
This is a complex procedure. Daniel's life is in their hands now.
Okay, so the patient is going to stop breathing and become flat unconscious. That is supposed to happen, okay? Okay, so that's a 99.
That's 1 minute.
Okay, fingers on for me, if you can, please, Lee. Scope right into my hand, please. Lots and lots of secretions. I've got a big epiglottis. I've got a grade 2 view. Bougie, please.
It's time to slide the tube into his airway.
Can you keep down? We sat somebody.
Yeah, 99.
I can feel the clicks.
I've got the bougie.
I have the tube. Tube's going down. A little rotation through. 22. Bougie out, please.
Bougie coming out.
Cuffs up. Slats are still 99. So chest is going up and down. I've got CO2. You have to have a quick listen, Lee. Okay, you can stand easy and talk as you do now.
Daniel needs cardiac specialists to identify the cause of his arrest. Lee is talking to the nearest heart unit in Hull.
Originally, ECG was quite indicative of an ST elevation MI. That was done at 16, 17, but his subsequent ECGs don't really demonstrate it. So it could be he's just got some underlying abnormalities with his conduction through his heart, and obviously with his previous, it would sort of tie in.
So hands on the scoop, lifting. So if you feed him down, keep pushing. Can you give her 1 mil of that?
Daniel's condition is critical. The team will be monitoring his heart function throughout the flight.
So, just a quick brief. So, numbers-wise, airways, we're happy with this tube, it's secure. The cuff, we've checked the pressure, we've suctioned the tube, we've checked the circuit, and we're happy with that. Okay, mate. Cardiovascularly, he's stable, blood pressure's fine with a bit of a tremolo. Right, happy for me to start? Yes, yes.
It's a 30-mile flight south to Hull and the nearest cardiac unit.
We'll go along the grass so that if we have an event, we can actually put it down there.
So it sounds like this chap's had a cardiac arrest on the street of Bridlington. We don't really know why. He's got some bit of cardiac history, but that's many years ago. He's a really big guy. So he does have some risk factors for having kind of ischemic heart disease. When we arrived, he wasn't breathing very well, he was unconscious, so we've decided to give him an anaesthetic, which I must say was a riskier thing to do, but because of his size and obesity. The risk is that you can struggle to get a tube in. However, we took lots of care to prepare that correctly, and fortunately, because of that preparation, it was straightforward. So we're just getting him in now to Castle Hill, which is a cardiac centre for this region, and we should be there in about 5 minutes.
Daniel's survival is in real doubt. His collapse at such a young age is a mystery. Every year, the air ambulance team fly to Germany for a grueling workout in a flight simulator.
You got to bring your height up now, mate, to whatever height you need.
To keep them on their toes, training captain Gary confronts them with a pilot's worst nightmare: double engine failure.
Engine 1 fail. Engine 2 fail.
It can be quite tricky. So today they were flying in IMC, so they're flying in cloud, so they've got no reference to the ground, so they concentrate on the instruments of the aircraft all the time. That's high workload. They're talking to air traffic, trying to get things right with the air traffic, making sure the aircraft's pointing in the right direction. And then coupled with an engine failure and fuel leaks and fuel pressure problems, it can get quite hard for the training pilots in the aircraft.
Chief Pilot Steve is just back and now in a real cockpit.
Okay, free takeoffs.
Both to fly.
Fly, both guided.
With real passengers, Tyrone, Al and Dr. Jez.
We'll just lift and go over the top of the building. I just want to let you know now that when I was at the sim, I crashed it 3 times.
Why did you say that? Why did you say that? Just as you took off the end of the shift.
He failed the switch, so I couldn't turn the engine off. He then disabled the over-limit protection on the engine, and then he'd failed the drive shaft on that engine as well. I had a really bad moment.
It sounds a bit ridiculous, that.
Today's medical emergency is deadly serious.
We're going down to Hathersage, which is in the Peak District. A request from our colleagues in East Midlands. I believe there's a HEMS paramedic on scene with a patient, motorcyclist, been involved in a collision. We haven't got a lot of information at the moment, but it sounds like the blood pressure's low, which is a sign of usually significant bleeding or some major chest problem.
The Peak District is the UK's busiest national park. The nearest major hospitals are in Sheffield and Manchester, a long drive in summer.
So it's down towards Hathersage, isn't it?
Yeah, so if it's where I'm thinking of, it's Surprise View Car Park. Roger. Yeah, this is it.
This is it here now.
This is the one.
DCA visual?
Yeah, DCA visual. Alright, let's just slow everything down. Oh, I think we'll have the car park this end, shall we?
That square.
Yeah.
Steve's aiming to land in one of the park's most famous beauty spots.
There's a car coming from the right, so we're just going to hold off until the car's gone past.
The car about 30 seconds away behind us now.
Yeah, roger. Patient's on the ground behind that vehicle.
It's just a motorbike there.
Yeah. Just going to turn the tail. There we go, we should be fine there now.
Yeah, you're okay. Tail's clear of that back in. There we go.
Okay, we're on.
The biker collided with the BMW. An off-duty paramedic stopped to help.
This is Michael, 58-year-old gent, riding his solo motorcycle towards Sheffield.
IT manager Mike Wells was thrown into the road.
He's T-boned a car at the entrance to the car park. We're not sure how fast he was going, but I suspect probably 40, 50 miles an hour.
Okay.
And initially he's up and walking about, chatting away. However, he's then had a bit of a hypotensive episode with a systolic of 74 and then a sustained low blood pressure of less than 80 systolic. He's got some swelling over this area of his back, and it's quite painful to palpate from the front as well. So I do wonder whether he's torn something in there and he's bleeding. He's had TXA from us, he's had some paracetamol, and he's had the 250 fluid.
Dr. Jez is concerned Mike may have a serious internal injury. The wreckage could give him a clue.
Yeah, it's fairly substantial, isn't it? It's kind of more of a kind of a side glance, isn't it?
It doesn't help explain Mike's mysterious loss of blood pressure. Only a scan in hospital can solve the mystery.
Michael, are you all right for pain at the moment?
Yeah, I'm fine.
Yeah, for pain relief, sorry. Because you're quite tender around there, we just want to rule out any internal bleeding and stuff.
He has a lot of pain in his abdomen.
It's difficult when you've got the petrol tank there and any sort of injury to your lower tummy. Right, is that what we normally do? Steady, lift.
The roads of the Peak District are notorious for heavy traffic, but Mike will be flying over the jams, direct to the major trauma centre in Sheffield.
Then do we push in here, Jess? Right, push.
Tyrone will be monitoring his condition in flight.
You didn't feel dizzy before you come off your bike, did you? Before you had an impact? You can move your head and neck and everything.
Yeah. Just going to put these over your ears. It gets a bit loud, so okay.
Sure it does.
I've got to come up a little bit because there's a bank behind us.
Yeah, we're clear of the back now.
Thank you. Right, coming up and back now.
Pilot Steve will have their patient in the Northern General Hospital in less than 10 minutes.
Get the nose round a little bit. I'm still pointing at the side. That'll do there. And transition.
99's lifted route in Northern General.
Turning right.
Where's your surprise view?
Yeah.
When the paramedic from EMAS arrived, he was up and about walking around, and then became quite unwell about half an hour with a very low blood pressure, which stayed low for quite some time. And obviously with that mechanism, your concern is he bleeding somewhere? He's had some treatment to try and reduce further bleeding called TXA, and we're just popping him down to the Northern General. We'll probably get a scan to see what's going on.
Pre-landers, please, Al.
Okay, pre-landing checks, doors and harnesses.
Close, secure on the right.
All good at the back. Radios and lights.
Radios, so we'll clear with Doncaster now. Landing light is on. And we'll just do a 180 round to the left onto the pad.
The hospital scanner is being made ready for Mike's arrival. If he does have an internal bleed, it will detect it.
ADS spinals, Northern General.
Okay, and there we go, LDP. All looking good. And landing on.
If he does have an internal injury, Mike could face immediate surgery.
MMI and lowering.
His outlook is uncertain.
Okay, close it down.
The Yorkshire Dales are home to 20,000 people, spread across 850 square miles of rolling countryside. Many are elderly. All are a long way from a major hospital. Today at RAF Topcliffe, Helimed 99 is being scrambled to back up ground units heading for a patient suffering a stroke in Wensleydale.
Breathe.
Mate, we'll depart out of here. Whatever's the best way, and then out towards the west.
It's a 20-mile flight.
Just hard discretion, that'll be VFR outbound to the west, Helimed 99 Alpha.
Okay, clear to the right in my climb. So we go towards the high ground in the 12 o'clock. Cloud base doesn't seem to be too much of an issue.
A response car is on its way to the scene, driven by one of the Dales' own team of paramedics.
Is there a crew there?
And Pete Shelburne on his way, I don't know if he's got there yet.
He should be there, yeah. I just wondered if there was an ambulance.
Ant and Lisa will fly the man to a specialist stroke unit.
We've been asked to go and look at a 90-year-old person that's got symptoms suggestive of a stroke. But obviously time is patient outcome with anything like this, so the sooner you can get them to the most appropriate hospital, the sooner they can start the most appropriate treatment.
The patient lives outside the market town of Leyburn. The sat-nav is guiding them to his home.
Okay, so I've got a mile to run, as per the grid.
Where the road sort of bends like a boomerang is where the pin is.
Oh, I've got it. I've got an RRV, I think.
I'll go where the trampoline is, mate.
Cool.
Pilot Lee is looking for a safe place to land.
Try to get those trees there, mate.
We're kind of directly over them at the moment.
Yeah.
There are a lot of hazards in his way.
So maintain, there's certain wires there as well, buddy.
Yeah.
So let's keep off them. Yeah, I just want to get into the ground cushion, mate. Tail's clear right, nose coming left. We're going to come down on that, I think.
Yeah, for a hard trim.
Yeah, tail's good.
Yeah, that's fine. All trim's fine.
It's less than 20 minutes since the patient's family dialed 999.
What do we call you, Derek or John?
Derek.
Derek, right.
Derek. Onset 12:30, witnessed facial droop left side and left-sided arm, numbness and loss of power.
Okay.
Dale's paramedic Pete Shaw has already run some tests.
So, Derek, you're having a bad day, are you? Has he still got symptoms now, Pete?
Yeah.
His symptoms are unmistakable.
Just stay with me, Derek. Does it still feel weak?
Yes, it's
squeeze tight.
No,
No, he hasn't got any grip on the left.
No grip at all.
No.
Right. Right then, shall we put you in our helicopter and fly you to Middlesbrough? Does that sound like a plan?
Yes.
This time you get a nice little flight in helicopter look at the countryside.
Aye. He's got what we call fast positive symptoms, which basically when you're having a stroke, we ask people to assess the face, arms, speech, and then test all three. Sometimes patients might present with a headache or loss of vision as well. Derek, since 12:30 this morning, has noticed a left arm weakness, slurred speech, and a left facial droop. His family picked up on it, which isn't normal for him. So it'd be an hour's drive to James Cook from here. So we're going to whiz him in the aircraft up to James Cook. Hopefully it'll take less than 20 minutes.
Derek's on his way to a specialist stroke unit in Teesside.
Nice slow
His son and daughter are concerned.
We'll be there when you get there.
We can take one of you two guys.
I'll go with him.
Right.
Then I'm coming with you, so that's all right. Yeah. Right?
In the Dales, the air ambulances are everyday lifesavers.
It might go straight to A&E or it might go straight to Ward 28. But just head to a main reception somewhere and they'll point you in the right direction.
Thank
All
you
right,
very much.
thank you.
Bye.
Right, I'll just lift into the hover, and then it'll be a vertical into the 12 o'clock. Got a tours degrade, happy to continue, continuing up.
Derek's lived in the Dales all his life. Now he's heading to the Regional Trauma Centre, 30 miles away.
Air desk from 99, we've lifted from scene and we are route to James Cook.
Get him to nearest stroke centre where they manage stroke symptoms and take about an hour and 15 minutes by road. So that's a long time, and time affects patient outcome in these circumstances. We can be at James Cook within 15-20 minutes, and if we've got a tailwind, much quicker than that. So obviously that speaks for itself, the time benefit that it can bring to this patient and his outcome.
135 mile an hour. Not too bad, is it?
It's a big shock for the family. Derek's always been fit for his age.
Okay, just bring the speed off, going to be to second now.
In the next hour, doctors will assess Derek for the most advanced treatment for strokes.
You.
He may be given drug therapy to dissolve the blockage in his brain, but the stroke could leave him with permanent disabilities. The Yorkshire Dales National Park contains 1,600 miles of footpaths through rugged countryside, and when there's an accident, help can be a long time coming. But not today.
Yeah, I'm just going to send you a detail, mate. It's Starbotted, it's Skipton. It's on the footbridge near the farm, just over the River Wharf.
Helimed 99 is being diverted from a transit flight, and the team are just 2 minutes from the casualty.
Yeah, we're just going to approach the village of Starbottom. What's the detail, Lieutenant Sam?
55-year-old female, fractured ankle.
A walker has fallen in Upper Wharfdale.
Oh yeah, that lady's sitting down there by the bridge, so I think that's probably her.
Yeah, it looks like it, doesn't it?
Got a few rocks on the ground. Yeah, I'm not going to go that much closer. I'm just going to come right a bit where it's fairly clear.
Pilot Harry's touching down on a riverbank.
Okay, leave us down and clear to our strap.
It's a popular area for ramblers, and their patient was on a walking holiday.
You really don't look comfortable.
Well, twisted off the step.
Off of that one?
Yeah.
Okay.
I felt a crack.
Okay.
And well, I just went down.
Okay, so it's all around your ankle. Can you feel me touching you there? Does that feel all right?
Yeah, fine.
Yeah? Just going to move your leg out slightly. So there's no pain down there, is there? No pain down that side?
No.
Liz Fleming was out on a camping trip.
Can you bring your toes up a bit towards your leg? Is that hurting when you move your foot?
On the underside, on the
other side.
Where you have
Okay, should try and sit you up and get you into a bit more comfortable position.
Yeah.
She fears her ankle is broken.
Move that leg as well, love.
Paramedic Paul's not so sure.
So it's swollen a little bit around your ankle bone there. All right, but other than that, it doesn't look too bad. You can move it a little bit that way, can't you?
Yeah.
Okay, how far can you push it? Okay, I think you've just possibly sprained your ankle. I know you said you hear the click and the crunch, but obviously, bearing in mind, you've obviously got two bones that run down there, and you've got all your bones, and obviously it's just attached a joint. So if you've sprained it, you can hear a bit of a crunching sometimes.
Liz was walking back from the pub, but she'd only had a Coke.
Now, we could fly you to hospital, but obviously the thing is the ambulance service is quite busy. We've been a weekend, and this area doesn't have a lot of resources anyway. So it's trying to work out the best way of getting you to your van to drive to hospital for an X-ray.
Liz is in pain, but she doesn't qualify for a flight in an air ambulance.
I'm so mad at myself. I just came down, just slipped off this stone step, heard a crack, felt a crack, so hopefully it'll be okay once these painkillers kick in.
Paul has a plan for getting Liz to hospital.
This area is common for walkers and people riding bikes, and Mountain Rescue obviously are aware of the incident, and they've asked if they can come and offer any assistance to us, so they'll come and give us an hand to carry a patient to the roadside.
Hey mate, this is Elizabeth, she's got an isolated ankle injury. Oh yeah.
Yeah, because I mean, what I want to do first of all is see if she'll be able to weight bear on it and walk a couple of steps on her ankle first. Yeah. And as long as we can do that quick movement, and then we'll see what happens. Is that all right with you?
That's absolutely fine.
Mountain Rescue is staffed by local volunteers.
Up with your good leg, that's it.
Here in the Dales, they're a vital backup for the ambulance service.
Do you want to use the bridge then, rather than use that?
Liz is going to be driven to her partner's van.
Gingerly reversing down, so we'll meet it part way up.
He'll be driving her to hospital for x-rays, while HeliMed 99 waits for more cases on this busy weekend. Thankfully, the local A&E confirmed what the team suspected. Liz's injury was painful, but minor.
I had an x-ray and then he came back to me and just said, you know, luckily it's not fractured, but you've got serious ligament injury that's going to take quite a while to sort itself out.
It meant it was a long time before she was able to get back to the Dales for a hike.
Probably about 6-7 months, I would say. So quite a long time before it felt stable enough.
But she's very grateful for the rapid response from the air ambulance.
Yeah, even though my injuries weren't severe, just the response and the care was just unbelievable. Yeah, amazing team.
Milkman Peter, who was crushed by his own truck, was found to be bleeding internally. He underwent 4 operations to repair fractures to his pelvis, neck, shoulder and right leg. It was 5 weeks before he was released from hospital, and he was forced to take 9 months off his milk delivering. Ex-cop Nigel suffered a collapsed lung, a torn spleen, and a broken collarbone when he came off his motorcycle after hitting a lump of steel in the road. He spent 5 nights in hospital. Surgeons discovered Daniel, who collapsed with a cardiac arrest on a seaside day out, had a faulty valve in his heart. He underwent surgery, but now he suffers memory loss and can no longer remember training for his job as a supermarket manager. Biker Mike, who collided with a car in the Peak District, escaped with a sprained wrist and severe bruising, and has now bought a new bike. No action was taken against the BMW driver. And 90-year-old Derek spent 6 days in hospital, being treated for a stroke, but he's recovering well and has gone home to the Dales where he's undergoing physio.